This is a presentation on OT for adults living with hearing dysfunction and emerging practice. My name is Allison Smalling.
And my name is Daniel Alarcon. Okay, so we wanted to start off with the prevalence of this condition in society. It's estimated that about 15% of adults in the US, age 18 and older, have some sort of hearing trouble. And it's also known that age is directly related to the probability of developing some type of hearing loss among adults age 20 to 69, but the age group of 60 to 69 has the highest prevalence of hearing loss. We also know that men are almost twice as likely to have hearing loss among adults, so their occupations could be affected more. And another statistic I found that was interesting is that from the ages of 45 to 54, there's a 2% chance of having a disabling hearing loss. And just 10 years later, that number increases about twice to three times the number. So we know that also about 16% of adults in the US between the ages of 20 and 69 could benefit from hearing aids, but have never used them. So that's also another area as OTs that we can help address that situation. When it comes to the history of hearing impairment for driving, the first area of concern is safety, of course. I found an article by J.D. Edwards and his associates. There was a 3-year study about hearing impairment with over 500 participants. And the results were that as you age, the driving from older populations did not stop, but also safety was a concern because they used something called a useful field of view assessment. And it showed that the older population had a smaller, limited useful field of view while driving. And this was most prevalent among those with moderate to severe hearing impairments within the community.
As I did research on the history of hearing impairments on childcare, it's very apparent that the research is limited. Most of it was on the pediatric population, and that's why it's understood that this is an emerging practice. According to the National Research Center for Parents with Disabilities, however, parents don't always get the support that they need. Healthcare and other settings may lack interpreters and professionals working with deaf and hard of hearing parents may not have the background to fully understand the parents' needs. That is the people working with the parents that are deaf and hard of hearing. Parents usually have a good relationship with their children. For example, parents have been found to be less assertive and share the decision making with their children. Both parents, both parents of able to hear and disabled hearing, the children develop similarly. And these similarities also extend to language and motor development, but there is little research on this information.
Okay, so some signs and symptoms associated with hearing impairment. So there is tinnitus, which is ringing in the ears after exposure to loud sound. This can be short-term or also long-term for some people. There's also hyperacusis or hypersensitivity. So it's noises that appear normal to other people, but they're actually very loud and sensitive to those with hearing impairment. Also struggling to hear high-pitched sounds, difficulty understanding others during conversation, in person or on the phone. These sounds can appear muffled or reduced, and also asking others to speak louder or repeat what they said. Another sign and symptom is injuries directly to the ear. We know that the ear is the area where they have the vestibulocochlear nerve, and it's also part of balance as well as hearing. And very less commonly known, but there's medication that are ototoxic that can also influence your hearing. and genetics or having chronic conditions such as high blood pressures and diabetes. As I mentioned previously, the vestibulocochlear nerve also includes balance. So hearing loss can have some kind of disruption in balance because of the anatomy located deep inside the ear, such as labyrinthitis, which is infection of the inner ear, or Meniere's disease, which is pressure within the innermost part of the ear.
So the impact of hearing impairment on child rearing. Between 500 million and 1 million people that are deaf or hard of hearing identify themselves as parents. And it's been noted that there's often discrimination in healthcare, education, and other settings. And this can lead to adverse and social health outcomes. The information provided for human services is often inaccessible to parents that are deaf and hard of hearing. So they may miss important information that includes information about parenting and, more importantly, information about childcare and also the outcomes of their pregnancy.
Okay, so the impact that hearing impairment has on driving is very significant. As stated previously, the older you are, the higher of a chance you have of hearing impairment. And driving is not only a visual activity, but you must also be able to hear adequately in order to make decisions in an instant. For example, when you're driving, if somebody's honking at you when you're trying to change lanes, or there's an ambulance or a cop driving by, or somebody on a bike passing in between lanes, these are all situations in which you hear before you see it. So it's very important to have proper hearing aid or be able to adapt the activity in order for the person to drive safely.
And now for the OT roles when dealing with adults with hearing impairment. In researching this, a lot of the information was related to pediatrics. So again, we understand why this is an emerging practice as there is limited information on the OT roles of those who are hearing impaired. However, when it comes to adults and especially the elderly, an occupational therapist provides hearing assistive devices that substitute for haptic and auditory input. And these categories include television, telephones, alerting devices, modified doorbells, alarm clocks, fire alarms, and kitchen timers. An occupational therapist will also promote safety and autonomy, increasing independence, environmental acoustic modifications, compensatory techniques, providing education on effective communication for the caregivers and family, giving them advice such as providing a well-lit environment and using eye contact when you're communicating with those who are hearing impaired. Some of the models that could be used is MOHO and the Canadian model and the person environment occupational model, and using the compensatory frame of reference and the occupational adaptation frame of reference. And occupational will also provide support groups, health education, and community resources to assist.
Okay, and here we have our references.
Thank you.